Hello, my name is Tristan Hutchison, and this is the oxygen and administration skills video. I want to make sure I have all of my supplies needed for this skill video, and I have the nasal cannula, I have the non-rebreather mask, gauze, and gloves. Okay. First thing I'm gonna do is make sure when I walk into the room, the door is closed or the curtain is pulled to make sure there is patient privacy. Second thing I'm gonna go ahead and do is walk into the room and make sure I use proper hand hygiene. Okay. The next thing I'm gonna do is I'm gonna introduce myself to the patient and then ask for two patient identifiers. Okay. So hi, my name is Tristan, and I will be your nurse today. Can you please tell me your first and last name and your date of birth? Great. Okay. I would make sure that I would check the wristband as well to make sure that the name and the date of birth matches with the wristband. And so it does, so I have my two patient identifiers. The next thing I'm gonna do is I'm gonna explain to the patient what we're going to do next. Okay, Mr. Smith, we're gonna go ahead and do an oxygen therapy. Your doctor has ordered some oxygen for you. Apparently your oxygen levels are a little low. So what we're gonna do is apply a nasal cannula and begin the oxygen, okay? So the next thing I'm gonna do is go ahead and put on my gloves. And at any time during this process, if you have any questions, sir, go ahead and ask away. Okay. All right, got my gloves on. I'm gonna go ahead and I'm gonna get my nasal cannula. Okay, so you got the nasal cannula here. All right. Okay, so this end here is actually going to be attached to the flow meter that is on the wall. And the flow meter, there's going to be two dials. One is green, the other one is yellow. The green dial is for oxygen, is labeled oxygen, and then the yellow dial is air. But we're going to make sure that we put this on and dial for the use the green dial for the oxygen. Also, the normal range for the nasal cannula is between 1 and 6 liters. For the purpose of this video, we're going to go ahead and state that the doctor has prescribed 3 liters. So 3 to 4 liters of the humidification. Humidification prevents drying of the nasal and oral mucous membrane. Okay. All right. So we have this attached, and I've adjusted the dial. You see the ball up to 3 liters. Okay. All right, Mr. Smith. So now the next thing we're gonna do is these right here, these little tubes are gonna go into your nose. You put this in your nose, and